Mic check. Can you hear me, Tayan?
Yeah, hear you well. Thanks.
Okay, shall we start the webinar? Right, good evening, ladies and gentlemen. Thank you for joining us in this Healthier SG webinar on care protocols. This is our first in a series of 9 webinars. If you this opening slide, if you think it looks familiar, it's because I actually designed it after the Netflix homepage. All right, so I call this season 1 of and this is tonight is episode 1, right? And you notice that we've got a whole series of webinars planned from 2nd of May, which is today, until the 27th of June. So every Tuesday night, please tune in here for this exciting series from 9:30 to 10:30 p.m. It's going to be quite a bit to cover, and we try to keep as much to time as possible because we know you're all very busy. The reason why we have it on Tuesday nights is because we're all busy GPs and we don't want to have it on Mondays. But today is the day after public holiday. So it's like Mondays today. So it's like I'm still stuck in the clinic now. I can't go home yet. All right. So I'm sure some of you are or maybe some of you are driving home from clinic. Okay. So yes, let's get on with it. And the first thing is to thank the people who are involved, right? First one to thank is Ministry of Health, MOH, for making this possible. AIC and MOHT. Okay. If you haven't heard of MOHT, it's the MOH Office of Healthcare Transformation. Right, they're going to be more and more famous. And today I actually have with me 2 co-hosts. The first is Dr. Tam Tat Yen. He's the visiting consultant at MOHT. He's also a private GP and PCM lead and a member of the Care Protocol Work Group. The second co-host is actually Professor Gerald Koh, the head and clinical director of MOHT. So they have got my back lah. Right, so you can see that this is a series of webinars we have from 2nd of May until 27th June. Every Tuesday night, there will be 9 in this series. First thing is that the entire series will be helmed by our college council members, right? All the names here are our council members, so thank you very much. And CME points, which is the first question you want to ask is, yes, we are trying to register for CME points. Supposed to be 1 point each, but subject to SMC approval, right? We are planning for extra CME points by having MCQs that you can log into on LMS. All right, there'll be 3 batches. So each batch will cover about 3 or 4 webinars, 20 MCQs. And if you complete them, you get extra points. So total in this whole series, between 10 to 12 points thereabouts, but yet to be confirmed. Who's the head honcho in charge? Council member is Dr. Julian Lim. He's on the screen. Hello, Julian. Thank you for organizing the whole series, and very happy for you to join us. We had lots and lots of sessions. I can tell you, it's really the last 3 months is non-stop webinar preparation, non-stop meetings. Okay, so thank you, council members, for being involved. All right, this whole thing is going to be run by family physicians. All right, and we will tap on specialty colleagues as resource persons when required. But from ground up, this is a primary care family medicine initiative. I'm Dr. Wong Tian Hua. I'm the vice president of the college. And today, series 1, episode 1, we're going to have an introduction to the health plan. So where are we now? All right. If you haven't noticed, pre-enrollment started yesterday on the 1st of May. All right. Pre-enrollment is from the 1st of May to the 4th of July this year. You can now opportunistically engage your regular chronic patients and enroll them in your clinic within this period. If you have signed the LOA before 14th April, you can start to pre-enroll them yesterday. Okay. However, if you signed it on the 15th of May onwards, you can only pre-enroll them from the 1st of June. Eligibility. Let me just get, you can pre-enroll your regular chronic patients aged 40 years and above and who have had 2 or more chronic visits within the past calendar year. This can be the list of patients submitted in your CDR or your chronic disease registry, or patients who have made CHARS chronic claims. Please note that during this period, there's no SMS invitation to patients for pre-enrollment. the patients will need to be in your clinic physically for pre-enrollment. All right. So if someone say it's like a silent mock, all right, in the Army, SAF, silent mobilization, there's no TTTT on the screen, no word, no SMS announcement, there's nothing. All right. It's silent. It's happening right now, and you just do it on your own. Okay, before I go on, I just want to say that because time is limited, any questions that you encounter currently, please key into your chat, in the chat function and ask, right? We have got a whole, I mean, not a whole army, but a whole platoon made of people at the back end to answer your questions on the fly, right? So I'm sure there'll be a lot of questions. So we wouldn't have to deal so much with the questions later, but as they come along, please just key into the chat box. Next slide. Okay, Healthier SG benefits such as the first health plan consult. Okay, this is very important, right? The first health plan consult will only commence on the 5th of July, 2023. So this is the date you must remember, because it's also in my MCQ question, right? 5th of July, 2023. So you need to schedule this. You can't do anything now. Schedule the first Healthier SG health plan consult for your patient from 5th of July onwards, all right? Not tomorrow, all right? Not the day after tomorrow, okay? 5th July. So why are we having Healthier SG care protocols? All right. So at its launch, Healthier SG will have an initial set of care protocols for the three very common chronic diseases: diabetes, hypertension, and cholesterol, as well as key lifestyle-related areas such as cigarette smoking and weight management. Why are we having this? Well, the purpose of the care protocols is basically to standardize care delivery. So tonight, we are here, we are here every Tuesdays on the webinars to standard set, right? We just tell everybody these are the standards we want, these are the data points we want to capture, so everybody understands what is required. Harmonized processes like a choir, you want to sing the same song, so you need to harmonize. You want to have clear referral and data flows, and of course, we need to have better coordination of ancillary support services. Additional care protocols will be progressively developed in future, but for now, there are only a certain few, which I will show you. These are the kind ladies and gentlemen at the back end who have been working very hard under the care protocol subgroup committee members, and I'd like to thank all of them. All right, and I'm showing them to the names here, and you can realize that number one, all primary care physicians. Number two, right, a spread of both private and public sector doctors, PCN leads, but every single one of them are, practicing clinicians. So you can be assured that all the care protocols are well thought and operational. Dr. Eng Soo Kyang and Dr. Jacqueline Yam are the leads for this care protocol subgroup. Thank you very much. Okay, so which are the Healthier SG care protocols? The list is over here. I actually screenshot from the web page, primary care pages, Healthier SG care protocols. You can search them online and they're live. If you go to this website, you see all these care protocols right now and you click on them, they're live, okay? They're basically organized into three categories, right? Under preventive care, of which there's adult vaccination, BMI control, cancer screening, chronic care for diabetes, pre-diabetes, hypertension, and lipid disorders, and what we call administrative, for example, today's health plan and the last webinar on GP First. This is also my MCQ question, so please take note. So today we're here, the health plan. So what's the concept of the health plan? Okay, firstly, all right, it's kind of like a well visit, all right? It's the first time, it's an opportunity whereby you're going to have a patient or your enrollee who's going to enroll in your clinic, and he or she is going to visit you in the clinic, all right? He's not coming in with a pain, all right? The patient is not coming to you with a complaint, right? In fact, sometimes the patient don't even know why they're here, all right, to see you. That's why you have to be very clear what is the purpose of the health plan. When the patient comes to see you, you have to explain and take initiative to explain the Healthier SG, all these action plans that you have in store for them. So it's a well visit. So it's an opportunity to have a conversation with the patient, right? It's kind of open-ended, but not at the same time, there are tasks that you need to perform. And also, very importantly, right, any advice, right, that you give during the health plan, it's going to be uploaded to the patient's Health Hub app on the phone. and therefore the information is going to be portable. It is kind of a first time it's going to happen, all right? So instead of the old days where, you know, the patient come and see you and, you know, you give some advice, the patient goes back, you know, forget half of them, you know, or whatever. But in this case, whatever you key into the health plan in the CMS or the data points will be reflected in the patient's health hub, and the information is going to be portable. So that's a very key difference. So the health plan aims to empower enrollees, right, to take charge of their own health. It facilitates health actions that lead to achievement of health goals with the support from the doctor and the community resources. Health goals is therefore personalized, all right? It's not something like, you know, putting your smoking cessation posters on the bus stop, you know. It is going down to the personal level already. It's telling the patient, you know, are you smoking? How many cigarettes are you smoking, right? And you need to quit smoking to that level, right? And it's never been tried before. It's the first time it's going to happen, right? It's going to promote patient empowerment and to nudge health improvements. So it serves as a communication tool between the patient and the GP, right? It enables, you know, the patient to understand the overall state of health, right? Ensures that care is delivered for not just disease prevention, but also chronic condition management. And this has to be timely and appropriate. And there are actionable steps, right? When you share the lifestyle goals with the patient. Okay, let's talk about Health Hub. You know, you have Health Hub, right? There's an app, you know, you can actually download it. I'm not sure if you have tried it before, but you should be on your phone by now, right? Health Hub, okay. So upon enrollment, doctors should initiate a first discussion with enrollees to develop a health plan, and details of a health plan, as I said, will flow automatically into the patient's Health Hub account, right? If you are using a Healthier SG compatible CMS. That's why all this talk about CMS, all this talk about IT, all this talk about, you know, upgrading a system, this is where it matters. When you have a Healthier SG compatible CMS, you key in a data point of blood pressure, you key a data point of BMI, it will flow into the directly into the patient's Health Hub app. That's not been done before, right? The key points from the digital version of the health plan as submitted by the GP will be shared with clusters over time. All right. So the first thing is the patient will see it, but over time, this data will be used in other relevant authorities. Enrollees will also be able to show the health plan through the Health Hub app on the phone to other partners. They can actually, it's a portable, you know, kind of health information. For example, when they go to active aging centers, if there's some advice on the health plan, they can show it to the counter, to the staff. This is called PCDS, Primary Care Digital Services. This is actually Plan B, all right. Plan A is your HSG-enabled CMS. When you key in stuff, it should flow automatically to the Health Hub. But if that doesn't happen, or you currently you don't have a CMS that's able to do it, you can rely on this thing called PCDS, all right? The Primary Care Digital Services. And it's live. If today you log into your PRPP on the website, which I did earlier this morning, you will see two selections, right? One is PRPP and the other is PCDS. If you click on PCDS, you have to sign in with the SingPass, and you end with the landing page like this, completely blank, all right? But you can see Healthier SG over there, and you're going to have enrolled patients, which you can start to select already. But in the future, you can use PCDS to key in your data points. How will it look? It will look like something like this. For example, in goal settings, there will be data fields for you to fill up, like lifestyle goal, BMI, right? You key in your weight, you know, and then, you know, any kind of goal in the next 6 months, quit smoking goals, you know, HbA1c goals, hypertension, blood pressure, you know, data points. When you key it on the PCDS like this, it will flow into the patient's Health Hub app. Quite clear. In addition, at the end, you will also have what you call open field, all right, for free text keying. So a record of discussions. You can actually key, right? For in this example, it says John has good control of asthma with regular preventive inhaler, you know, blah, blah, blah. So when you key that in, you will also flow automatically to the patient's Health Hub, and the patient can see it on his phone. All right, he can show that to his cardiologist, he can show that to his respiratory physician. So there's open field data for you to fill up, right? It's like a report book, you know. John, didn't pay attention in class, that kind of thing, lah. You can do that. This is the Health Hub app, right? If you haven't seen this logo, please be familiar with this logo. If you haven't got this app, go and download it, right? Health Hub app is, on Android and iOS platforms, right? When you open the Health Hub app, you sign with SingPass, and you can see your name and even people under your care, like your children's name, right? Or your parents' name, they are there. If you click on a name in future, right? Not now. This is what it will look like when there's a health plan, right? So you can, for example, in this case, you can see the lifestyle goals, right? Reach or maintain your target body weight of 65 kg in 3 months, quit smoking by this. Who keyed in this data? Is you, the GP, who's keyed it in, all right? You are the person who keyed it in, all right? All these things will show up in the patient's app, including, this open field, your record discussion. Eileen has good control of asthma, the regular behavior, blah, blah, blah. Okay, so this is exactly what the GP has keyed in. So this is an example of what's going to happen. It's quite clear. Okay, so what about health plan? Actually, quite simple. The key elements that need to cover is you have to cover things like recommended health screenings according to what is provided for in Screen for Life, right? Recommended vaccinations, any advice on healthier lifestyle changes, and any actions that's related to management of chronic conditions. So at this point of time, it's pre-diabetes, diabetes, hypertension, and cholesterol. Things will be added in future, all right? What's important is do not feel that it's going to be overwhelming, all right? You don't have to cover every single thing, but whatever that's relevant to the patient. Further details of all these will be shared in the coming webinars, right? Webinar 2, 3, and 4, and so on. You have more details on what is required for each of these individual action items. So yeah, they'll be covered in this webinar series. What's very important that I need to say is that the data you enter has to be appropriate and accurate, right? Keep a good record in your CMS. The data that you key in will be seen and shared by the patient. So as they say, rubbish in, rubbish out. So don't key wrong data, all right? For example, if you key the weight, in pounds instead of kilograms, then, it's going to lead to a lot of problems, right? The blood pressure, if you're not sure, measure 2 times, 3 times, get an average, make sure it's accurate, right? Because all these things will matter, right? It's no longer your own records, It's no longer you write in the records and then, oh, wrong, and you can rectify or, cancel and sign off, It's something that is going to go to the patient, right? So it's going to be, like prescribed to the patient. So the data has to be appropriate. The data has to be accurate. The second thing I want to actually say tonight is that it is an ethical prerogative that any advice you give should fall within the scope of acceptable body of practice, as well as supported by scientific evidence, right? I mean, I feel compelled, right, as a representative of College of Family Physicians, that to remind you that you should always practice within what is deemed acceptable practice. So it actually goes beyond, for example, what you contracted with on the LOA with MOH, This actually goes back to the oath you yourself took when you went for the physician's pledge ceremony, that kind of, ethical standard, right? So for example, right, it's not for you to give, and now give advice, right? For example, patient should stop smoking, maybe should try vaping instead, I mean, that is illegal, right? That's crazy, right? For example, right? And also do not abuse the health plan checkup, right? And lock the patient into the room for 1 hour and play a video of a high pressure sales tactic to buy your packages, for your clinic, right? So stick to the plan, right? The health plan is not a open-ended conversation for you to do anything you want. It's there for you to have a specific task for the purposes of Healthy SG. It's a bit like, the 6 monthly medical checkup, right? I mean, the helper is coming to see you for specific tasks, right? To check, screen for certain things, right? Right. Of course, sometimes they'll say, they come with other complaints. For example, they have got body pain or aches, and you attend to those things as well. But your prime objective is really to get the data points for Healthy SG, right? In this case, okay. So that's the concept. So with that, let's go into a quick run through of what you can do during the health plan, right? The first thing, of course, is the history, right? And the concept now is that, the patient is coming to you, it's not, oh, what can I do for you? What is your complaint? Why are you here? It's actually, you have to say your opening statement is actually, thank you for coming. Thank you for enrolling with me as a doctor. And this is what we're going to do next. So the concept is not patient-driven, but doctor-driven in a health plan checkup. Patient-driven means that the patient is coming to see you for a complaint, right? Pain or diarrhea or flu or fever, whatever. But in this case, you have to take the initiative. You have to use the time allotted to you, 15 minutes, 20 or 30 minutes or whatever, and drive the conversation, right? Get the information that you need, for purposes of Healthy SG. So things like medical history, right? What's the current, medical problems, any chronic medical problem, especially if it's first time, right? First time consult, you need to spend some time. A lot of the patients, of course, will be your regular patients, so you don't have to spend so much time on those, right? Family history of medical conditions, history of health screening and vaccination, lifestyle factors, which is very important, right? Smoking status, exercise and physical activity, diet history, alcohol consumption, if any, and occupation. Okay, physical examination tailored to the history and chronic conditions if relevant. Take some basic measurements, right? The height, the waist circumference, and blood pressure. Come up with a diagnosis or problem list and any treatment plan where appropriate, including any labs or radiological investigations, and update or schedule for those age-appropriate screening or vaccinations that is provided for, and give them advice on healthy lifestyle changes, right? Like smoking cessation, physical activity, dietary advice, any weight loss targets, right? Dr. Suraj will be talking about obesity counseling. There's the 5 A's for obesity counseling. It's a very useful tool, for example. And take reference to any guidelines or any relevant protocols. For example, from ACE. Make referrals if required, and then set goals for the patients, right? Discuss and encourage patients to set goals, targets with dates, all right? So something that's actionable, and specify a date for the next check-in. So of course, it sounds very simple and very quick, but of course, we all, as practicing clinicians, know that every single patient is different. Every single patient will come with different things, different requests, and that's why it's all going to be very personalized. What's the timeline for completing a health plan? It is recommended that an enrollee's first health plan should be completed within 6 months upon enrollment with a GP. For new patients, GPs should reach out to schedule appointments with them, and this expectation will be conveyed to enrolling residents. GPs should also conduct health plan discussions opportunistically when a patient visits the GP. For example, this is the pre-enrollment phase. If you have chronic patients coming to see you, you can enroll them and tell them that they should come back after July to do a health plan assessment. How often does the health plan need to be updated? There should be regular scheduled check-ins to assess the enrollee's overall health condition and progress. For each check-in, discuss the progress for the health goals, and if it needs to be adjusted or any additional intervention required, every time you key into those data fields will be updated as well. For well enrollees defined as enrollees with no chronic conditions, an annual check-in should be performed. Do note that the first check-in should always be done in person to establish rapport and some kind of relationship with the patient. And any subsequent check-ins can be done through phone or video, although the recommendation is that it should be done at least once every 3 years, as long as the enrollee remains generally well. For chronic enrollees with at least one chronic condition, at least you need to have at least 2 chronic consults in a year, basically, all right? And the health plan consult is counted also as 1 visit, if I'm not wrong, right? And you need to update those data points during these visits, so at least 2 times a year. Okay, GPs are encouraged to tap on their PCN care team and, of course, make use of the nurses or care coordinators where appropriate, right, to help you with realizing the patient's treatment plans and to meet their goals. Data submission. A key aspect of health plan is goal setting, right? And I've already said this, there should be a simple set of shared goals that has to be entered into the Health Hub app. This can be submitted through your CMS template or through PCDS, right? So there are two ways, right? Of course, the most simplest way, Plan A, is always using an HSG compatible CMS. These goals will be reflected in the patient's Health Hub, and the list of goals should be reviewed and adjusted in future. And as I said, aside from those shared goals, there's also a free text box that you can key in. So these are a sample of what are the data points that you can actually key in. For example, lifestyle interventions, target body weight, quit smoking by a certain day, DHL components, exercise, and all that. Now, what I want to also emphasize is that it is not a requirement to complete each and every data field. All right, I mean, it's there, but you don't have to, go through every single one of them and complete everything. Only the relevant ones for the patient. All right, so some basic ones, I think, like height, weight, blood pressure, okay, right, you can do, but not everybody, you'd have to find out what's the HbA1c. Not everybody who, those who don't smoke, they don't smoke, right? It's great, right? You don't have to do anything about asking them to quit what they haven't started. And financing, right? GPs will be paid a fixed fee upon completion of the first health plan discussion, right? So after you submit the first health plan, automatically you will be paid how much? $50. Okay. Very important. You should not be charging a consultation fee for this visit. Right. The comms is out that when the patient sees you for first visit health plan checkup, they don't pay anything. Right. You will get reimbursed for the $50 fee, but they should not be paying anything. So this is where it's a bit nuanced. There's some, of course, already questions that we asked. If let's say a patient has got not just this health plan problem, but they bring up other issues, then you to see how you need to treat them for other issues that are not related to HSG, for example. Then you can, of course, work out how you can charge them a consultation fee or separate kind of a billing. That's all I have for today.